Good evening, everybody, and thank you for joining us for this evening's webinar on supporting access to housing and independent living for autistic and disabled people. My name is Adrian Carroll, and I work as Senior Policy Officer with AsIAm, and I will be your host and facilitator for this evening's webinar. AsIAm, Ireland's autism charity, are proud to be grant-funded members of the Disability Participation Consultation Network, which is proudly supported by the Department of Children, Equality, Disability, Integration and Youth. As part of our work with the network, AsIAm will be hosting a webinar on the AsIAm is hosting a webinar on the topic of housing and independent living and being included in the community, which forms part of the United Nations Convention on the Rights of Persons with Disabilities. So, just to give a flavor of what independent living is, this is about more than just having access to housing, but also about having the opportunity to decide where and with who you want to live with, any supports or facilities that you want to live the kind of life you want to live in, and what type of community that you want to live in that best meets your needs. So this webinar will cover what independent living is according to UNCRPD, Irish and EU policies and perspectives around how Ireland and other countries put independent living into practice, how housing can be made more accessible to autistic people in our community, and AsIAM's work on highlighting these issues. So since 2014, AsIAM's work in supporting autistic people across Ireland has included engaging with and supporting autistic people and families across Ireland to have the same chance to access housing, to live independently and be included in their community. As we know, that housing plays a key part in making sure that everybody has the right to dignity, choice, and control over their lives, and to feel accepted and included as they are. However, our Same Chance report shows many autistic people face barriers to accessing housing and can experience greater feelings of loneliness, social exclusion, and not feeling safe to be themselves. So this will be covered later on in this webinar. So tonight, I'm delighted to be joined by 5 incredible speakers who will be sharing their insights, expertise, and experience with us. So joining us this evening is Hayden Hammersley, who is Social Policy Coordinator with the European Disability Forum, Jamie Williams, who's a member of the Wexford Housing and Disability Steering Group and Director of the Dream Big Foundation, Cara Morris, who's Policy Officer with AsIAm, Danny Burns and Fiona McGonigal, who from the NSAI and Interior Snoop and Fiona and from the NDA respectively. So just to kind of give a brief overview of some of our speakers this evening. So Hayden works as a social policy coordinator with the European Disability Forum. So he is responsible for EU cohesion policy and structural and investment funds, European Pillar of Social Rights, European semester, deinstitutionalization and community-based care, employment, education, social protection and disability assessment. So he also coordinates work on the European Disability Strategy. Hayden has previously worked for Autism Europe, working for a member of the European Parliament as a trainee at the European Commission for the Toulouse Gulbenkian Foundation. So he also has previous experience working as a background and as a care worker and as an assistant to autistic adults and adults with learning disabilities as well. So Jamie Williams is co-founder of the Dream Big Foundation. Carl Morris works as policy officer for AsIAM on a community support team. So he works in the background of political campaigning, public policy and communications. He's previously has background as academic officer for DKIT during the COVID pandemic, and works in policy and research matters affecting the autistic community, ranging from social protection to employment to education and assessment of needs. Danny Burns is a design commentator on the built environment and its impact on neurodivergent experiences. Her design observations echo principles found on the Aspects Autism Design Index and were included in Magda Mustafa's exhibit at the Venice Architecture So she currently serves on the NSAI Expert Committee for for drafting standards in universal designs and drawings. So just to kind of give a bit of background to what we're going to be covering this evening as well. So Hayden will be speaking for 20 minutes, and following speakers will also be speaking for will be speaking would also be given 15 minutes each to speak about their presentations this evening. We hope to give time for around 15 minutes for questions, and we will finish up by 8:30 p.m. as well. So if you have any kind of questions in the meantime, you can use the Q&A function, and they will be answered at the end of the webinar. Finally, I just want to kind of say that if you find any of these webinars or resources helpful, we would greatly appreciate it if you would take time to visit our website at AsIAm, and if possible give us donate to help us to support our work. So finally, well, we also want to kind of say that this work, we could not do this work without the support of our community, and this webinar is proudly supported by the Department of Children, Equality, Disability, Integration and Youth. So our first speaker this evening will be Hayden Hammersley of the European Disability Forum.
Thank you very much, Adrian. I will just start sharing my PowerPoint, so I think it's going to be a problem. Great, and I'll just make it full screen. So hopefully you can hear me well, and now it should be full screen. Great. Okay, well, first of all, thank you very much for having me with you today. I think it's going to be a really interesting discussion, so I'm quite excited to hear what the other speakers will have to say as well. So yes, as Adrian mentioned, I'm the Social Policy Coordinator at the European Disability Forum in Brussels. What I will present today is sort of three things, essentially. So I'd like to talk to you a little bit about some of the tendencies we see in general in Europe with regards to the number of people in institutions, whether things are going in the right direction or not, and so on. Then I would like to present what we have come up with at the European Disability Forum in terms of some suggestions, some recommendations for how to facilitate the transition away from institutional care towards independent living and inclusion in the community. And then at the very end, I will show you some sort of bad examples of things we see still being funded, still with EU money, and the kind of thing we're trying to move away from. Please forgive me if I sniffle a bit, I'm a little bit sick, so I hope that won't be too distracting. So first of all, where are we now in the European Union regarding deinstitutionalization? A report from a few years ago shows that actually there are still a lot of disabled people and people with other type of support needs still living in institutions. The number is around 1.5 million people. But actually, it's quite difficult to know exactly how many people are in institutions because the type of data we have available to us is quite hard to find, and often people living in institutions simply aren't being counted. The other thing, and this is kind of the main message, is that unfortunately the number of people living in institutions doesn't really seem to have substantially changed in the last decade. So in some countries, they're making progress towards having more community-based services, and in others, it's the opposite, as we will see. There's some research by Eurofound, which is a research agency of the European Union, which is based in Ireland. And they have some research which actually hasn't been released yet, but we've seen the draft. So I sort of share this learning, but it's not been released officially, which found that actually 11 of the EU member states have more disabled people in institutions now than they did a decade ago. So we see this in Denmark, in Croatia, in Ireland, Latvia, Malta, the Netherlands, Poland, Portugal, Sweden, Slovenia, and France. The biggest increase we saw was in France, actually, where the number has more than doubled. So there's really a big investment in settings which are institutional in nature, but also big increases in Poland and in Malta, for example. In terms of the countries doing a bit better, we see Greece with a net reduction. Estonia, Hungary, and Spain. So it's really a mixed bunch of results. And then actually for children living in institutions, so not only children with disabilities, but all children requiring care outside of family, actually 14 member states have seen an increase in the number of children in institutions. So particular growth has been seen in Latvia, Estonia, and Cyprus. We're not entirely sure as to why there have been such increases or why it's happened in certain countries and not others, but we have these figures and it's something we're looking into with great interest. And I'll skip over this slide very quickly because I think I put a little bit too many slides for my time allocation. Adrian already mentioned this, but I think it's just important to again go over what we consider to be an institution. So when I mention the word institution, you know what I'm talking about. So these are settings where we see isolation and segregation from the community. They're living settings with no or limited influence over whom one has to accept assistance from. Of course, we see a clear lack of control over day-to-day decisions, things such as what time to get up, what to eat, who you spend your free time with. So all of these choices, which are very basic to our day-to-day activities. Quite essentially as well, lack of choice over whom to live with. This is one of the basic things about when we talk about talk about independent living as opposed to living in an institution. Not being able to decide freely on when to visit friends or family, or having this decision taken by someone else who will say, okay, your mum will come to visit you at this time and you don't have a choice. Facing restrictions over if and when you can have guests over, a rigid routine irrespective of your personal will and preferences. And then this is also a common aspect that we see, which is imposing group activities under the authority of the service provider. And then independent living is quite the opposite. It's important, I think, for this audience, you know very well, but I give similar presentations sometimes to groups that know a lot less about independent living, and that think that independent living really means doing everything alone and completely autonomously, which isn't the case for everyone. It's about having choice and having support to live a life based on choice, essentially. So including, of course, who you live with and where, having your own possessions, and also having choice over how you're supported in your life. And this is another slide, continuing this. I will share the slides afterwards with you, and this gives an outline of the European Disability Forum's view on these different definitions that we have. And then finally, deinstitutionalization. So this is important because we talk about it a lot. In simplest terms, it's the process of closing down institutions and moving towards independent living and the necessary community-based services. What we always say, and this is an aspect that people who are in favor of institutions often raise, is that they're worried institutions will be closed and people will be left on the streets. There will be no alternatives for them. So part of the deinstitutionalization process is, by its definition, having something ready or having alternatives that are well suited, ready for people before they leave institutions. It's a transition. It takes time. It requires planning, support for the people concerned, and requires ensuring their transition to accessible housing in the community. Yeah, and the last point is what I mentioned at the beginning. It's essential that the process of moving away from institutions does not result in residents of institutions being left homeless or in vulnerable situations because of poor planning. So this is very important. Having said that, there's no reason for the transition to take a very long time, so we can be quite proactive about it. And that's why it's essential to create conditions for living in the community as a matter of priority and to invest heavily in this. So people actually do have the perspective of moving out if they want and in the way that they want. So we see a lot of human rights issues in institutions in general. The main ones and the very consistent ones essentially relate a little bit to the definition I gave of institutions. So the fact that As a human being, you're denied your choice over how you live your life. You're not allowed to see who you want. You have restrictions over the personal connections you have with others, including your family. You're denied the ability to form meaningful relationships, which includes loving relationships, romantic relationships, and you're compelled to take part in certain activities, even if you don't want to. But on top of this, there are some cases, of course, where we see quite severe human rights abuses. So in some cases, and these, there are cases that are quite well documented and appear in the media, but behind these, we know that there are other cases where people are still living in fear and in secret, essentially. There are cases reported of course, severe abuses, violence, sexual assault, and even in some countries, there's still cases of forced sterilization against girls and women with disabilities. And children in institutions lack support for their development and are more likely to be left outside of education. So these are, of course, quite severe cases, but they do happen. Okay, so now we get to the point where we talk about some of the recommendations that we give, because we don't just want to say how bad institutions are, but we want to think about some of the things that policymakers in the different countries of Europe, but also, of course, everywhere in the world, can try to do to help this transition away from dependence on institutions. Again, I think I won't have time to go over all, but I will try to mention the ones I think are the most important. What we say first is preventative action. So a lot can be attributed to planning ahead and stopping disabled people and also their families feeling like they have to turn to institutions as the only resort. We are very much in favor of financial support being given to informal carers when it's a child with disabilities or when it's an adult disabled person who wants to have their support provided by a loved one, that person should be reimbursed or compensated financially for all of the assistance that they give. Also, guidance for families on managing certain medical conditions. So, of course, this isn't the case for everyone, but in some cases, families don't feel able to offer the support that they feel is needed because there might be a complicated medical issue that the family member has. Also, guidance on understanding support systems and planning for the future. So knowing what government subsidies you might be entitled for, what services you might be able to get for free. Sometimes people just don't take up things that they're entitled to because they simply don't know. So this information needs to be made very clear and readily available to everyone. In-home support. So of course, this is a good alternative to having support given in an institution. Sometimes it can be a type of support linked to needs a person might have because of their disability, or sometimes just helping out with some practical things in the home to keep things running and to take some strain away from the disabled person or from their families. It's important also to have mechanisms to retain personal links to your family and the local community. So the more isolated you are, unfortunately, the more likely you are in time of need to have to turn towards an institution. So if you don't have that support network with you, you're really a lot more at risk of being institutionalized. And then that goes also with support for finding employment, for managing your finances. So especially nowadays, it's quite a big risk to fall below the poverty line, and that can also be a deciding factor in if somebody ends up going to an institution or not. And then, of course, and this is a huge issue nowadays, and I know it's especially the case in Ireland, support for finding and retaining accommodation that's affordable and accessible in the community. This family support and informal care I've kind of covered, so I will skip over this, but all of this to say families also need a lot of support. Then it's really important supporting people when they leave institutions. It's not just a question of assisting somebody in being able to leave and find an alternative, but a lot of follow-up should be offered. So firstly, it's important to have accessible information and support disabled people who have been living in institutions to clarify what their options are for accommodation and support services outside. So some of the options might be new. They might want to talk through the pros and cons of certain things like personal assistance, which can be very good, but also sometimes you have to do a lot of planning on when your personal assistants come. So good to have a lot of frank and clear information about those. It's also, when you leave an institution, you'll suddenly be confronted with a lot of choices in your day-to-day life, and that does take some getting used to. And that's also an area where support can be given. Making choices about your nutrition, about where you want to live, about what kind of activities you want to do. Just support, not telling people what they should do, but just access to information that can be useful to people leaving institutions. Again, rebuilding links with families and friends. This is really only if the person wants to. Of course, some people have complicated links with their families, but if it's something the person wishes, this can be very useful to build this support network and regain strong links with families and with close friends. Some people, of course, will leave with psychological and physical trauma from what they've experienced. So again, these things need to be addressed. Otherwise, they can really snowball and become a lot more serious. So access to rehabilitation, therapy, support groups, legal support if something very serious has happened. These are all really important. And again, providing opportunities for employment, which can, again, be a great way to integrate into the community and to have the resources to live and to make ends meet. Education as well, if somebody wants to learn and try something new in life, support should be given for this. This slide I will skip over, and I'll talk very quickly about personal assistance. Personal assistance isn't the solution everybody wants, but lots of people do want personal assistance, and it can be a good option for a lot of people. So we see that in almost all European countries, personal assistance is very much underfunded. The demand for it greatly is much bigger than the offer. And in order to make personal assistance programs work for persons with disabilities, it's really essential to increase, first of all, the amount of personal assistance that's covered by the state in line with the person's needs, so that the person isn't paying out of their own pocket for support that they deem necessary. To reduce waiting times for people who have applied for state-funded personal assistance. So here in Belgium, for example, we have quite a good system in the north of the country, but the waiting list is very, very long. So in that sense, the system isn't as good as it claims to be. And also to make sure that there's this is provided through personal budgets that go to the person requiring personal assistance rather than directly to the service provider. So that way, you as a disabled person will receive the budget you're entitled to, and you can spend it on any service you want in the way you want, and you're really in control of the support you get. This one I will also mention because it's important, which is that governments need to invest in training support workers and personal assistants, because as I mentioned, as is the case in Belgium, there is a lack of personal assistants available, and especially good ones who are trained. So it's important to promote careers in the field of personal assistance so that we have enough people to meet the demand by disabled people who want personal assistance. That they be trained in the principles of the UN Convention on the Rights of Persons with Disabilities, so that they understand what the rights of disabled people are. And also, beyond personal assistants who work directly supporting disabled people, to train staff working in mainstream services to be able to understand and meet the needs of disabled people they work with. So in hospitals, in transport services, and I think especially when it comes to the autistic community, there's a lot of misunderstanding, and because in many cases it's invisible, the solutions or the things that can help people remain quite unknown. So we'd like to see a lot more training on that. Awareness of alternatives I've mentioned, and I think I'll try to finish on accessible and affordable housing, which I know is a huge issue. And I mentioned the case of Ireland because it's a little bit of a famous case, unfortunately, now in Europe when it comes to affordable and available housing. Um, so this is something that governments should be investing in greatly, regardless. It's a social need in general, but particularly when it comes to disabled people, there's such a shortage, excuse me, of housing that's accessible and that can be affordable for this community. So that's something that needs to be invested in, and it really thought needs to be given also to how accessible the housing is, not just how cheap, and also making sure that not all housing that's accessible to disabled people is far away from the city center in kind of ghettoized neighborhoods. It really needs to be part of the community and not pushed to the sidelines. Okay, and I think I will send these slides so you can read the rest. We have a new, oh no, sorry, I will, I will just say one more, which is on accessible communities. I'll say this in a few words. The built environment and public spaces are often very inaccessible in European countries. It's the case in Brussels, in the city where I live. So it's all well and good having access to personal assistance and accessible housing. But then if the street outside your house, if the bus stop, if the tram stop is completely inaccessible, you end up being a prisoner in your own home. So accessible public spaces is a real priority when it comes to public investment. Okay, and now I will just finish very quickly by showing some examples, some bad examples of residences for disabled people that we've seen funded in different European countries using EU funds. And I'll describe the images for anyone who might need the audio description. So the first one is in Poland. It's an old school, which is about 4 stories high, very wide building. It has a fence around it. It's clearly not a home setting. It doesn't look anything like a home. Very kind of clinical, not at all homely. And it's a residence for, I think it was 130 disabled people. And it's not at all, inclusive or community-based, and it doesn't have any emphasis on independent living. So this has been funded using EU funds, renovating this old school, and it's something that we actively were fighting against and made an official complaint to the European Commission. And then just before I finish, I have a few, but I'll show just this one, which is in Austria. It looks, again, I would say, like a sort of school. It's 2 stories high, but it's a very big building. It's again, doesn't look anything like a regular home setting. It looks more, yeah, like a school or like a kind of prison. It has a wire fence around it. It's surrounded by fields and forest, which, okay, is quite serene. It's quite relaxing, but there's no local amenities. There's no easy access to leave as you want and go and have a coffee or go to the cinema. It's not at all independent living or community-based services. So these are the things we still see being funded by the EU and that we're trying to build awareness around and fight against. And with that, I think I will stop sharing, and I hope I haven't taken too long, and I'll hand back to Adrian, I believe. Thank you very much.
Hi, Hayden, thanks so much for your fantastic presentation. That's really helpful to kind of give a background and context from a European perspective, and also to kind of give and also to kind of learn more about kind of independent living and deinstitutionalization from just from a policy perspective, but also from within a wider from a wider EU context as well. So we now move on to our second speaker for this evening, which is Jamie Williams. And Jamie, before we begin, could you give us a brief background, or who will give us a presentation or speaking about her lived experience as an autistic person sitting on a housing committee and before. So just over to you, Jamie.
Yeah, that's no problem, Adrian, and thank you so much for inviting me on today. I'm not sure, because I'm on mobile, you might have to be the one to share my presentation. I'm just gonna try and see. bear with me here.
I think what I can do actually is like you can speak to your experiences and I can share the presentation afterwards.
That's
How does
fair.
that sound?
That's perfect. Thank you very much. Okay, so my name is Jamie Williams. I am the Public Relations Officer on the board for the Dream Big Foundation. I'm a nominated representative in Wexford's Housing and Disability Steering Group. I'm a certified disability advocate. I design forward-thinking, solutions-based initiatives for wider government and charity use as a special interest. But first and foremost, I'm a neurodivergent mother to two neurodivergent children, and I have a neurodivergent husband with different disabilities as well. And it's through being a service user myself that I have gained the lived experience that comes from trying to navigate the system alone. And people can often find themselves, I think, in dire situations very quickly without the right supports. And I know that from personal experience. And that's why I'm extraordinarily grateful to have been nominated onto Wexford's Housing Disability Steering Group by AsIAm through a call out that they did on social media. Because as it turns out, there are not as many people with lived experience on these groups as I would have liked to have seen. And that could be a contributing factor as to why we're not where we want to be yet as a community. Still, it's a very good group, and I have very high hopes for the future. My very first meeting in that group was eye-opening for me. And immediately after having seen a presentation by the Healthy Age-Friendly Homes program, that was Aoife McGrath put that on, and it was fantastic. I was able to identify a gap in services, which would greatly improve the lives of disabled families like mine, and for people with disabilities who are looking to live independently, which is so important. And so I have come up with an initiative called Adapt at Home, which is well on its way to being accepted as an upcoming pilot program, and will soon be discussed at national level. And so that's what my presentation is about here. I'm not sure if it's sharing because it's not coming up for me.
That's okay, Jamie. We can kind of work through the presentation we can work through the presentation and we can send on over the slides afterwards.
Okay. So basically, this is a program modeled on the Healthy Age-Friendly program, Healthy Age-Friendly Homes, which is theirs is for over 55s. And so what we do is we take and put a disability coordinator at the door of people with disabilities. Now, my program is starting small. I'm going to be starting with families of children with disabilities. Okay, so it's going to be probably nine areas to start out with for the pilot program, which is a 2-year program. And so what we're really going to do is we're going to go in and we're going to assist in signposting and handholding through every need that you come across as a service user. So whether it's helping you to adapt your home into the home that you need, if that's possible, or help you to move to the new place, find a new home that's more suitable, that will be done. Whether this is a financial issue that you might be having and you need to fill in a load of forms, we'll be hand-holding through that process and signposting to the areas that you need, whether it's signposting to different grants and things for possibly adaptations that you need on the house. That will be something that we do. And maybe you're just lonely and you want to reach out into a community group. And so each disability coordinator would be kitted out with a special tablet with geolocation on. And so I'd be able to walk in as a disability coordinator and say, okay, well, these are the areas that are around. These are the different groups that are available to you, and how can I help you to reach out and do these things that you want to do? And that's really what we need in a community. And also what we'll be doing is we'll be signposting to technology and so different areas of technology that would really help you to live independently. And one of the things that I'm personally pushing for is to be signposting to AAC devices. And so I'm really doing this program, which is going to be hopefully funded, state funded, and state run, in combination with some things that I'm doing over at Dream Big, because I would be spearheading different programs there as well, which would run really, really well in tandem with this, which would be like a tech program where we're looking to refurbish and redistribute donated and new technology that's been donated to us. Things like AAC devices, which would be, so handy because when you're talking about living independently, being able to communicate your needs, especially as an autistic person, and if you're nonverbal, that's what's important, being able to advocate for yourself. So that's one of my personal pet projects there. But we'll also be putting together independent living facilities and respite facilities with 24/7 support on hand for the people who need them. So these kinds of things, having the physical facilities available is obviously very important. Having the supports needed to get where you need to be and having that access is also critically important. And I really believe in combination with the physical supports, Adapt at Home will go a long way to ending the culture of institutionalization here in Ireland and provide the future that we hope for our children. So, thank you very much.
Hi. Thanks so much, Jamie, for your powerful presentation and for sharing for sharing your voices and experience and for sharing your experiences and sitting on the Housing Disability Steering Group. Just to kind of give a reminder to attendees as well, just we'll be sharing the slides after the webinar. Over the coming days as well. Just moving on to our next speaker as well is Carl Morris, who is senior policy officer who is policy officer with AsIAm, who will be speaking about some of our findings in relation to housing and independent living from the Same Chance report, and also speaking around some of the issues that we engage with on the community support team on housing and independent living. Over to you, Carl.
Thank you very much. Hopefully everybody can see my slides on screen. Yeah, like Adrian said, my name is Carl. I'm a policy officer with AsIAm. And have been for about 9 months now. The purpose of the slides that I'm sharing with you now and the presentation I'm going to run through over the next 10 minutes or so is to outline some of the data that we have from our community. So some of the community voices that we've received in the last couple of months, namely through our Same Chance reports, our Same Chance survey and subsequent reports that we published in April this year, to run through some of the housing specific data on it, but also some of the broader societal data that is relevant to housing and independent living. And then as a appendage to that, then at the end, I'd like to run through some of the work that AsIAm does on housing specifically. So some of the groups that we sit on, some of the other groups that we link community members in with, and then as well as some broader supports that we offer that would include supports on housing as well. So as I said there, the Same Chance survey that we run that every year. This year featured the largest number of responses that we've got since we started conducting the survey. So it was about 1,748. It's about 3/3 of those are parents or family members representing an autistic child, and about a quarter are autistic adults themselves. But obviously housing touches across everybody. The Same Chance survey, like I said, it's an annual survey which provides autistic adults, young people and their families the opportunity to engage with us to provide a snapshot of autistic life across all areas such as day-to-day barriers, accessing their communities, loneliness, education, healthcare, mental health, discrimination, housing, of course, and the economy and jobs. This year's survey was slightly different because we normally have a card holder survey, which features people's feedback on the use of our autism ID card. Those questions were removed this year, just for people's information. If anyone was ever looking at previous year's reports and wondered why those questions were missing. So I just featured a slide here that outlines some of the broader findings, some of the kind of headline numbers. These are across the life cycle. Like I said, they're not explicitly related to housing, but in particular with stuff that the previous two speakers have mentioned, you can see the impact it would have on housing, or the impact that housing or lack of housing and lack of supports, wraparound supports with housing would have on these things. So just to pick a few, 38% of people don't feel safe and protected in their community. 36% have experienced discrimination in the last year on the grounds of their autism diagnosis. 74% said they incurred extra costs on the grounds of being autistic. 53% said the businesses in the community weren't accessible for autistic people and weren't inclusive. And 81% said that social gatherings were not accessible or inclusive to autistic people and their families. And then the last one I draw your attention to on that slide there is the top 3 barriers to inclusion. It's interesting that obviously lack of supports and services comes out many times, as you'll see throughout the rest of the slides I've shared. And that really is very, very pertinent to housing and the issues that the community faces within housing. So on the housing specific, Alison, I have other slides after this, where that looks quite bare. 1 in 4 people who we surveyed, and this is the entire group that we surveyed, so this includes parents of autistic children as well as adults. 1 in 4 said their current housing situation did not meet their needs. 1 in 8 of the total group, so that's including people who said their housing situation did meet their needs. So 1 in 8 had engaged with their local authority on their housing situation. And of those who had engaged with their local authority on their housing needs, 46% said their engagement was negative. So almost 1 in 2 of those who did engage with their local authority said they had a negative experience. Now it's down from 55% last year. However, it's still a very, very significant minority, almost half, were being treated negatively by their local authority, and we'll go on to some possible solutions to that later on. But these are just the raw data of what our community told us. So then when we get onto the independent living piece, when asked, do you believe that you / your family member have enough support to live independently in your local community? 63% said no. Which is obviously incredibly stark and has massive impacts on other areas of people's lives, such as loneliness, social isolation, life in the community, day-to-day barriers, as well as knock-on effects on mental health and other things, and access to education. So that's quite stark. 63% said they don't have enough supports to live independently within their community. And it gets back to what Adrian was saying about not just being a house, not just being a 4 walls of building. It has to feature that wraparound supports for autistic adults to live as independently as they can, and also children as well and their families. Now, just as a broader point outside of housing, but I think this is again, it shines a light on it. When we asked the community on a scale of 1 to 5, with 1 being not very supported and 5 being very supported, how supported and accepted do you / your family member, if they're filling out on behalf of someone else, feel when participating in your local community? And the average weighting of that was about 2.7, so kind of about just over halfway. So could be worse, but also still a massive, massive way to go along that journey of people feeling accepted in their own local community, or their family member feeling accepted in their own local community when involving themselves in day-to-day activities that non-autistic people just don't suffer the same barriers for. Again, when we go wider, it was mentioned earlier on in the presentation, like we say from other speakers, but when we surveyed the prevalence of loneliness, so we asked in the last 12 months, how often have you / your family member felt lonely and or socially isolated? You can see there about 38% said either all of the time or most of the time. So basically what we're looking at here is the community as it exists right now are experiencing social isolation and loneliness about 4 in 10, which is which is about double the national average for the general population. Which 20% are either lonely all or most of the time. And you can understand how a lack of wraparound supports for independent living would contribute to that. Then just finally, before I pass back over, to end on some of the stuff that we're doing on housing when AsIAm. As I'm sure many of you will know, the government plan for housing and the construction of housing is Housing for All. That's a 10-year plan. That's a multi-annual, multi-billion euro plan, which aims to offer increased housing stock, access to quality homes at kind of affordable rates and bring house prices down. As a result of that, there was a national housing strategy for disabled people specifically. So that's running from 2022 to 2027. AsIAm joined the National Implementation Steering Group for that strategy last year. So we meet regularly with other stakeholders, with other local authorities, and that steering group oversees the delivery of housing stock, accessibility in terms of applications per local authority. So every local authority has to report back to that steering group. And AsIAm sits on that and can ask questions, make submissions, as we did recently on the allocation, assessment and guidelines. Allocation and assessment guidelines. So AsIAm made a number of recommendations on how people should be assessed and how people should be allocated social housing. Such as autism, ensuring that autism was regarded as sensory disability by all local authorities, not just some who were best practice. And also when an autistic person who had lived in the community for a considerable amount of time was making an application for a different housing or a modification, that they were prioritized to stay in their community. As often autistic people rely on family members or to avoid any kind of disruption to routine and predictability. Also, we've linked in, as we mentioned earlier on, with 6 thematic groups, which are more specific. We link community members in with those. So accessible housing communities, interagency collaboration, the provision of supports, affordability of housing, communication, access to information, knowledge, capacity and enterprise or expertise, and strategy alignment. And the last 2 points I'd make, we are celebrating currently the 1-year anniversary of the Joint Oireachtas Committee on Autism's final report. So that's a report that made 109 recommendations across the life cycle of autism. It made 14 recommendations on housing and the built environment in general. So such as ensuring that every application process was accessible, that every local authority had a disability officer in place to again help with the application process and the assignment of the allocation of housing. We continue to campaign for the full implementation of that report. Majority of the actions are still outstanding, but we continue to campaign on that as a real linchpin of all the advocacy work that we do. And then the final point then, our information line, which is there 0818 234 234, and that's that information line team provides a wide range of supports included on housing and signposting, if any community member ever needed it to access it. I think that's all I have to say, but like I say, I'm happy to answer questions at the end. Thanks, Adrian.
Thanks so much, Carol, for your fantastic presentation. So just our final 2 speakers for this evening are Fiona McGonigal of the National Disability Authority and Danny Burns. I'll pass the floor over to Danny and Fiona as well.
I think I'm going to take the lead first, so I'll just share my presentation. I'm going to be very quick. Am I sharing the
yeah.
Oh, sorry. Oops. Not sharing now, isn't it?
Yeah, it's all good.
Okay, so I work in, my name's Fiona McGonigal. I work in the Centre for Excellence in Universal Design in NDA, and I'm just going to give a bit of background. We're developing a new standard for universal design dwellings, and just I'm going to set a bit of context first. So, starting at a sort of international level, the 2030 Agenda for Sustainable Development sets out "Leave no one behind" as one of the key promises. And as you can see on screen, there's the Sustainable Development Goal 11, make cities and human settlements inclusive, safe, resilient, and sustainable. And obviously, housing is a key element of this. So nationally, within a legislative and policy sort of context, Part M of the building regulation sets out minimum requirements for buildings. The regulation states that adequate provision shall be made for people to access and use a building, its facilities, and its environs. And it aims to ensure that regardless of age, size, regardless of age, size, and disability. However, for this applies to new buildings other than dwellings to be accessible and usable, whereas dwellings, it just requires them to be visitable. So this it would be the intention of our standard to be looking at how we can design dwellings that are accessible and usable regardless of age, size, or disability, throughout the life course of a person, and allowing people to live independently in their homes for longer. So staying nationally, the standard aims to support the policy within Ireland. There's the housing options for our ageing population, the National Housing Strategy for Disabled People, and then also increasingly local authorities are including objectives within their local area development plans, as the hope of this standard that we can help meet these objectives. Some examples are Carlow, the 5% in excess of 20 dwellings, and Dublin City, 25% of apartments in excess of 10. Yeah. Then just a bit of background. Some of you may be aware that in 2015, the Centre for Excellence in Universal Design published our parent document, the Universal Design Guidelines for Homes in Ireland. Its objective of by providing a standard rather than a set of guidance that universal design dwellings can become more mainstream. This document has been used kind of as a baseline to inform a starting point for the development of the standard for universal design dwellings, in addition to multiple other resources. And then I'll just touch, so the Universal Design Dwellings standard will set out requirements and recommendations for two categories of universal design dwellings, known as UD dwellings and UD dwellings, or UD plus dwellings. So while UD would aim to accommodate a wide range of users, including some wheelchairs, UD plus goes a bit further and would aim to accommodate most wheelchair users. However, it's worth noting that while there's a number of these spatial provisions that would be associated with physical disabilities are actually considerations that benefit a wide range of users and neurodiversities. An example of which is like a spatial requirement for a wheelchair user would also benefit a person using an assistance dog. The development of the standard has involved working with a wide range of people with differing perspectives, and we've been very fortunate to have a fantastic working group inputting on this, made up of experts, DPOs, and people with a wealth of lived experience, which has really been of great value to the development of this. While we're not currently at a stage where we can share the content of the standard, as it's still subject to change through public consultation, I would like to highlight to everyone today that we are aiming to bring the standard to public consultation in October, November time. So would welcome input from anybody here today on that. So keep your eyes out for it. And then I'll just pass over to Danny now. Thanks.
Hi, I'm just going to try and share my screen. Okay, is that working?
Yeah,
Okay, and can you hear me?
yeah, we're all good, Danny.
Okay, thank you. So I'm Danny and I'm on the committee for UD dwellings as well. And I'm there because I felt like I've been running through life experiencing the built environment from a neurodivergent perspective, but didn't know what it was until later in life when I had been diagnosed with ADHD. And, oh, they're not changing. How do I change the slide? There we go. So I was late diagnosed with ADHD, and all of a sudden it made sense why I was struggling with loud sounds, busy environments, bright lights. And this curiosity led me to the work of Magda Mustafa, who had articulated a design index that is in line with autism-friendly design principles. So these are 7 principles. The first one is acoustics, spatial sequencing, escape space, compartmentalization, transitions, sensory zoning, and safety. And what I hope to do is show some best practice examples that I've observed. And these are all the people behind the scenes that are designing for neurodivergent friendly spaces. The first example, which looks at acoustics, would be by Ready Architects. And they worked alongside Linda Horgan, an occupational therapist, when they were refurbishing the James Joyce Library at UCD. And one of the details that I really liked was that they had used recycled cork to cover the walls and then ran strips of wood along these for like an undulated surface. So that helped with mitigating acoustic reverberation. They also introduced textured walls through linen wallpaper fabric, and they repeated those down in long corridor spaces where sound tends to travel. And neatly, actually, they've got hidden storage behind all those panels as well for extra chairs in the library. The floor plan of the library is a good example of how spatial sequencing comes into play with acoustics, and also looking at routine and predictability. It's something that they've applied on all floors of the library. So there'll be the same predictable spaces where at the middle, where the main entrance and exit is, you've got relaxed group work areas where people can talk and collaborate. And then as you move towards the edge of towards the outer sides of the building, the sound is lowered. So you might have semi-focused areas with shared desks. And then towards the edges of the floor plan, you'll have areas where silence is observed. You'll have a sensory room, a transition room, and higher acoustic control of the spaces. Escape spaces, these can be achieved through fun ways and through having hanging chairs, swinging hammocks in an area of a room that could be divided off with a curtain. What Nicola did with Studio Red Architects was use a spare bedroom. It's a small room. She painted it dark, framed it a tree with the window. And this would be a space separate to the bedroom for her autistic son. And she changed the floor material into cork tiles. So underfoot, it felt like it was a space that was a calm space. It was different from the rest of the house. It can also be achieved through window seats. Seen on the right there, that's in a Maggie's Cancer Care Centre designed by Abe Rogers. Looking at compartmentalisation, this was an example from DCU University. It's a new bedroom concept for the autism-friendly rooms, and where they show compartmentalisation through furniture arrangement by having the bed in a little cabin. And then they also added in LED lighting that can mimic the times through the day, and the user has control of if they needed to nap and rest when it's daylight. So it's just controlling the space through compartmentalization. Also being able to hide away storage behind those doors and minimize visual clutter. Another use of compartmentalization but in the home by studio-led architects would be in the kitchen, living, dining space. And what they did here was have space for movement and pacing that's integrated within the living space. And then also for visual clutter, they're able to conceal any objects behind these slide and hide doors really quickly. Moving on to transition space, this example, although it's not residential, it's a Maggie's Cancer Care Centre that's located in a car park site within a busy hospital. And what I wanted to just highlight is the benefit of having a curved transition pathway between an area of high stimulation outside the home to an area of refuge and enclosure by walking through planting and more of a natural landscape. In a residential setting for transition, having a wide door, like a deep threshold with a wider hallway where coats can be stored out of sight to minimize any visual clutter, but also you can have two people walking side by side, or if you're allowing someone to arrive, there's enough space to walk alongside by with a service dog as well. The sensory zoning part of the framework is where designing a space for its sensory quality rather than its functional quality. So here, having space to have a bath is highly beneficial for the therapeutic benefits. Also having natural light with a window which can frame the sky, using calm, natural colours that don't compete with other sensory input happening with water. And then the final part of the framework would be safety. And what I like here is Nicola has removed the temptation to climb in on the stair banisters. So she's put floor to ceiling louvres, which look really beautiful, but also it stops and minimizes any risk of falling and climbing. What I've just added into the slides here, which I think will be shared, are some useful information where you can find details about aspects, but also there was a PhD study on learning from experiences of autistic adults and the role of the built environment in independent living. And I've shared the link there. It's a 20-minute video that talks through the research. And then also the housing adaptation article by Magda, which looks at spatial quality, spatial organization and integration that I found really useful to look at. So I just wanted to share that as well. And that's everything. Thank you.
Thanks so much, Danny, and Fiona for sharing for sharing your expertise and your experience around around kind of like the aspects framework and around universal design. Just to kind of give a flag, just to kind of flag it with you that I'll stop I'll stop recording the webinar at this juncture before we move on to the Q&A section.